Welcome to the educational recording for the topic Assessment and Intervention for Orthostatic Blood Pressure. The Catch Rural Falls program is supported by the Nebraska Department of Health and Human Services, Office of Rural Health, through the Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not necessarily represent the views of our funding source. I am Dawn Venema. Vicki Kennel and I form the UNMC Catch Rural Falls team. We are both faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I'm a physical therapist, and I bring the clinical perspective of fall risk reduction to our team. Vicki is an industrial organizational psychologist, so she brings that unique viewpoint to our team with expertise in quality improvement and organizational and team science. The educational objectives for this recording are to, first, measure orthostatic blood pressure as part of a thorough assessment of fall risk, and second, identify appropriate interventions when orthostatic hypotension is identified as a risk factor. The Centers for Disease Control has a nice framework to follow for fall risk management of older adult patients in primary care settings. It is called the Stopping Elderly Accidents, Deaths, and Injuries, also known as STEADY, initiative. STEADY recommends 3 steps, the first one being screening, where you are trying to get a quick snapshot of whether or not a patient is at risk for a fall. The topic of screening is covered in another recording on our website. Steps 2 and 3 are assessment and intervention, and they are what follows if a patient screens positive for being at risk of a future fall. Assessment is a step to take where you are trying to identify specific risk factors that place that patient at risk for falling. In other words, why is this patient at risk? If a given risk factor is identified as being present, then the next step would be to address that risk factor, particularly if it is one that is modifiable through intervention. Depending on the type of risk factor present, the intervention might be able to be addressed right within your clinic, or it might require referral to other healthcare professionals or community resources. The CDC has a nice algorithm that walks you through these 3 steps in more detail. The link on this slide will take you to it online. Here is a picture of the algorithm. Here, I'm highlighting those steps of assessment of specific risk factors, which then leads to intervention for any risk factors that are present. Here, I'm highlighting the specific risk factor of orthostatic hypotension to show you that it is one of many risk factors that can be assessed, and the suggested interventions that follow should the patient be identified as having orthostatic hypotension. If your patient tells you that they feel dizzy or lightheaded following a position change, like when rising from bed in the morning, you should suspect orthostatic hypotension as a cause and assess for it. Measurement of orthostatic hypotension is simple, but it does take a little time to go through the process to do it correctly. The CDC has an instruction sheet on the STEADY website that walks you through step by step. The link to those instructions are at the bottom of the slide. The first step is to have the patient lie down for at least 5 minutes and get a baseline blood pressure in that position. Then you have the patient move into a standing position and take the blood pressure at 1 minute and 3-minute intervals. Orthostatic hypotension is defined as a drop in systolic blood pressure of at least 20 millimeters of mercury, a drop in diastolic blood pressure of at least 10 millimeters of mercury, or experiencing symptoms of lightheadedness or dizziness upon the change in position. Now, you want to make sure that you don't place the patient in a situation where they might fall while you're taking this measurement, so I have some logistical advice for you to consider. Be aware that older adult patients may need some assistance to safely move from a lying to a standing position, especially from a surface they're not used to, like an exam table. Consider whether a gait belt should be applied to the patient before doing this measurement in case you need to provide some steadying support to the patient once they are in standing. If they typically use an assisted device, such as a walker, have it close by so they can use it for support if necessary once standing. Another practical suggestion would be to leave the blood pressure cuff in place but deflated so that you can more easily start taking the measurement upon standing, especially if you might have to help steady the patient. An automated cuff might be easier to manage for this test than a standard cuff, and stethoscope for any patient who may need some balance support. Now, what should you do if you identify that your patient does experience orthostatic hypotension as a risk factor? There are various options for interventions. Probably the first thing to consider is whether a medication adjustment is needed. If the patient is on antihypertensive medications, those should be reviewed and you should consider whether a change is warranted. Other medications might be causing orthostatic symptoms as well, so review and adjust those if necessary. There are several simple behavioral changes that a patient can also be educated about. For example, pumping their feet up and down several times before changing position helps with venous return from the legs to the heart and can prevent a blood pressure drop with position change. Pausing a moment between position changes can also give blood pressure time to normalize. For example, after sitting up in bed, pause for a few moments before moving on to standing. Advise patients to have some sort of upper extremity support to use at least briefly upon moving into the standing position until their blood pressure normalizes after that change in position. Other tips include sitting down when able for activities of daily living, sleeping with the head slightly elevated, and avoiding situations where you might get overheated, such as excessively hot baths and showers. Hydration might need to be addressed with your patient to address orthostatic blood pressure because low blood volume can contribute to low blood pressure. And lastly, compression stockings might need to be considered. That said, these can be extremely difficult for anyone to don and doff, but especially older adults who might have arthritic joints and weakness in their hands and extremities. So these are likely not the first intervention to consider. The CDC has a nice patient education brochure outlining many of these steps, especially the behavioral changes, at the link provided to you on this slide. In summary, measurement of orthostatic hypotension does take a few minutes, but is fairly simple to do. Do think about some practical considerations for how you can most easily take the measurement, particularly if the patient needs some physical assistance with the changes of position. We also discussed 4 types of interventions to consider for any patient who does have this as a risk factor: medication changes, behavioral changes, adequate hydration, and compression stockings. Links on this slide will take you to information I shared in this presentation. That concludes the recording on orthostatic hypotension. Thank you for listening.